Heart disease is the leading cause of death worldwide, which is responsible for a third of all deaths that occur on a global basis. Myocardial infarctions are basically heart attacks, which are caused by coronary heart disease. Many times people aren't aware that they can suffer from a heart attack in the near future, and about 26.9% of people who had a prevalence of a heart attack were not diagnosed at the appropriate time. Rather, they found out about it when they actually experienced it. I'm Sophie, a 17-year-old, and I'm interested in the area of artificial intelligence and cardiology. You've probably heard the term heart attack a lot, but not completely sure of what exactly it is. Well, a heart attack takes place when the amount of blood is decreased because the blood is restricted from going to the muscular tissue of the heart, which is also known as the myocardium. And when the myocardium doesn't get enough blood, it can then result in a heart attack. Sometimes heart attacks are silent, so they aren't diagnosed until you go to the hospital and perhaps get an ECG test done, but other times it's clearly visible that a person is having a heart attack because they either have severe discomfort in their chest, they have slurred speech, or they can even go into the state of paralysis. And if it's not treated within a timely manner, it can also cause death. Unfortunately, sometimes as soon as some individuals experience a heart attack, they can also just have sudden deaths. There are risk factors like smoking and like abnormal lipid profile, which is basically just cholesterol, because cholesterol is a fatty and waxy compound. When cholesterol builds up, in your blood vessels and arteries, and then we also have factors like hypertension, lack of physical activity, not having a healthy diet, and a lot of alcohol consumption. This all leads to whether an individual has a type of coronary heart disease or not. To create my myocardial infarction system, I use Logistic Regression and the K nearest neighbors algorithm, which is also simply known as KNN. So a KNN is a supervised learning algorithm, and it's used for both regression and classification, but in this case we're using it for classification because KNNs can predict the correct group to which the test data belongs by calculating the distance that's present between the test data and then all of the training points that are also available. And then with that, the K number of points closest to the test data are selected, and then with that, the algorithm calculates the probability of the test data, so what belongs to the classes of K, in KNN. So that K training data and the class that the highest probability will be selected, and then that piece of data point will go to that category. So for example, we have a cat and a dog, and we want to identify whether the organism is a cat or a dog. So we'll use our KNN algorithm model to find features for whether it's a cat or a dog, right? Like the ears, the fur, the tail, or the pattern on the cat or the dog. And then with that, we'll provide those specific images to the model, and depending on the most similar features, the image will either be classified as a cat or a dog, depending on those features that are present within the picture. And then with logistic regression, we have two discrete outcomes, so we either have true or we have false. So that helps us to model the probability from the given variable input. So with the inputs we get from the user, we then get answers from our model, the output, so which would be true or false. To be specific, the main data features of this model include demographics, so sex and age of the patient, and then we would have behavioral data that tells us whether the patient's a smoker or not, and if they are a smoker, how many cigarettes they consume on a daily basis, right? Because even half of a cigarette is really risky for an individual who has prior history of perhaps heart disease in their family. And now moving on to past medical history, we would have to consider if the patient has ever taken blood pressure medication, if they've ever had a stroke, if they have hypertension or they deal with stress commonly, or if they have diabetes. Because if you have diabetes, then that also plays a really big role in the diagnosis of heart disease for a patient. And with current medical records, we can take into account the body mass index of the patient, their total cholesterol levels, in present times, their heart rate, their glucose level, their systolic blood pressure, their diastolic blood pressure, and that all ultimately just leads us to predicting the variable, right, which determines whether the patient can have a heart attack within the next 10 years or not. If it's probable that they can, then they will have to take the precautions in order to maintain their health and make sure that they don't encounter that problem. So if you found this video interesting and want to learn more, feel free to read the article because I go in depth about my whole model and code as well. Be sure to follow me on Twitter, check out my monthly newsletter, which is Sophie Spectrum, where I share highlights of every month, and all the links can be found in the description. Don't forget to subscribe, and I'll see you guys in my next video with more exciting projects. Bye!